Hi, my name is Kyle Clower and I'm with Serve Wisconsin. We are the Wisconsin National and Community Service Board. We work the AmeriCorps programs throughout the state and strive to promote national service and volunteerism throughout Wisconsin. We're so very pleased to be sponsoring the Governor Service Awards again this year, and we're interviewing all this year's honorees. And today we're talking with Monica Kramer, who served at the Health Net of Rock County through the Wisconsin Association of Free and Charitable Clinics, and who's being honored as the AmeriCorps VISTA Member of the Year. So Monica, thank you for joining us today.
Thanks for having me.
Congratulations, and thank you again for your service at Health Net of Rock County.
Thank you. Yeah, it was a big honor, even to hear that I was nominated.
And then Monica, could you start off by telling us a little bit about the service you did as an AmeriCorps VISTA member with the Wisconsin Association of Free and Charitable Clinics at the Health Net of Rock County?
Yeah, so I worked in Janesville, Wisconsin with Health Net of Rock County, and I did a lot of things. I focused mostly on data collection. I was so lucky to have electronic medical records to get to work off of. So I helped provide data for fundraising, for our annual reports to our board, and for our quality assurance and quality improvement committee.
And can you tell us about your role helping with the Seal a Smile program there?
Yeah, so HealthNet runs the Seal a Smile program for the school district of Janesville. We have a dedicated dental hygienist who goes into the schools and does evaluations, sealants, and fluoride treatment for students from pre-K all the way up through 8th grade. So what we did last year was we sort of dug deep into the data of how many forms we were getting back. Was there a particular school where we're having an issue, and then doing extended outreach to parents. So that involved filling out as much information we could on forms and then resending them out to specific kids in the hopes that we would get more back. That helped us increase almost 200 students this last year, and also showed us that a lot of the responses that we were getting from parents saying they couldn't participate was because the program didn't include their children in that grade, because we only could take kids on Badger Care in certain grades. So that helped us rewrite the grant for this year, which we are now serving all children regardless of insurance status in all grades, which hopefully will help us see a lot more kids and see a lot more uninsured kids too.
And can you describe the service you did there helping out the procedures in their pharmacy?
Yeah, so we had a new pharmacy tech start, and we were sort of seeing that there was no coordinated, here is how you do certain things. So one of my very first projects was sort of learning how to use all of the software. We have different software for the medical side and the pharmacy side, and sort of writing it all down and working with all of the staff members, from our volunteer pharmacists to our nurses to our case manager, of how we order medication and also how that medication gets put into our medication room and how it gets distributed to our patients.
And then you can tell us about the service you did helping their care for their diabetic patients.
Another goal that we're working on is glycemic control in diabetic patients. About a third of HealthNet's patients are diabetic. And of that, we really want to see how well are we doing, and are we seeing any improvement with continued medical care and medication and access to insulin, which is one of the big things that we can provide. So I really dug into how to make that easier to report, how to find it more quickly, and I sort of had to go back in and redo the last 2 fiscal years of data, but it really showed that we are seeing a lot of improvements. We have over half of our patients are under very, very good control as defined by the American Diabetes Association, and we have very few patients, especially when you look at the national statistics for Medicaid and Medicare, of people who have extremely high A1Cs. We have very few of those people. So even if they aren't perfect, they're still working towards good control for diabetes.
That's great. And so Monica, why did you decide to serve as an AmeriCorps VISTA member? And is there something that brought you to serving with the Wisconsin Association of Free and Charitable Clinics?
I've always been really service oriented. I've been volunteering at nature centers and at farmers markets since I was about 12 or 13 years old. So it was something I knew I was really interested in. So I graduated from college and I was interested in medicine, and I wanted to get some more hands-on experience. And so I sort of looked at where you could get this kind of experience. And I have a lot of family connections to free clinics and federally qualified health centers. So that was sort of what I was focusing on. And I found the WAFC VISTA program, and it looked really great. And I really loved HealthNet's focus on the immigrant community. My grandparents are refugees, so it's a community that I connect really strongly with.
That's wonderful. And then when you applied, did you know it'd be for the position at HealthNet of Rock County?
No, so I just applied to WATC in general, and I think they had listed a specific site, but when they contacted me, they said, okay, that site's already been taken, but here are a bunch of other sites in your area. At that time, I was still living in Milwaukee, but I knew I had the opportunity to move to Madison. So they were like, okay, here are a couple different options, but we really, really think that you would like HealthNet. HealthNet is really big and very well staffed compared to a lot of other free clinics. They have over 20 staff members and many, many more volunteers. So it's a really big organization. And so it was a really great opportunity to get the real sense of what a clinic works like, because it feels so much like a regular doctor's office. You would never think walking in there that it was a free clinic.
That's great. And so Monica, looking back your experience as an AmeriCorps VISTA member, do you have any favorite memories or some highlights of your service you could share with us?
I would say some highlights of my experience are getting to help with the diabetic food box program. It got scuttled a little bit by COVID, but in the fall when I first started, we were getting about a ton of food, literally 2,000 pounds of food delivered every month that we got to distributed to our diabetic patients. So I got to help unload all that and get it into the fridges. But then also I got to do the data side of tracking, okay, for the patients who are getting this food, are we seeing improvement in A1Cs? Is it any different than everybody else? So we saw that, yeah, it really was working and the people were really enjoying it. It was a really interesting project because it was culturally directed at the Latinx population that we serve mostly. So it was not just, apples and oranges. It was food for that community that we developed specially for them.
And Monica, I think that starts hitting on some of the impacts of your service. And I know that a large part of VISTA service is about building up capacity and through gathering data. And so what are some of the impacts you're able to see from your service?
I think I saw that we had a lot more information to give our board of directors in the community. And also our staff got a lot better sense of the community they were serving, because especially during COVID, they've been working their butts off. They've been hustling every single day just to get the medication to people, then to get appointments set up. We were doing a mix of virtual and a couple in-person appointments when I left. And it just takes a lot of manpower. And so I got to use my data and really show people, this is making a difference in people's lives. And I was really lucky that I had the capability, and everyone's so amazing that I could really say no, you are really helping people. You are helping people stay healthier in a concrete way that isn't just people telling you that, it's the numbers, which I think is really special.
And Monica, you just mentioned the changes happening due to COVID-19. So how did your source have to change due to COVID this year?
Yeah, so I was in a slightly unique position because I live in a household with two other healthcare providers in different systems. So we were a little nervous starting at the beginning of March because we had 3 people in 3 different clinical settings in Wisconsin with different levels of patient contact. So I was kind of prepared for the fact that, I could be exposed pretty early, and I was ready to start working from home from mid-March. So when Governor Evers first issued the safer at home order, we were like, okay, stay home. I think we had a couple weeks of sort of regrouping and figuring out what we were going to do. But luckily, because we had the electronic medical records that are web-based, I could do most of my job from home. So I really just continued doing data collection. Obviously, I couldn't do the clinic-based stuff that I was doing before, but I got to dig in on some more time-consuming data projects and look back at older data that I didn't have time to do before. So I really got to focus in on that. So probably from mid-March to the end of May, I was completely virtual. I definitely had enough stuff to do for the first month and a half, but it started to be okay, I do need to get back into the clinic. And because of the grant from the Advancing a Healthier Wisconsin Foundation that WAFC got, we were able to transition into telehealth appointments, which sort of also we slowly crept back into normal operations. So I started going back just a couple days a week. I never really returned to full time until the last month. And especially because the Hispanic community in Rock County was so hard hit, there was just the potential for a lot of exposure at HealthNet. So we had to be really careful.
And then did your VISTA term just come to an end recently?
Yeah, at the beginning of September.
And then what are your plans following your VISTA service?
Right now I'm working as a case investigator for the City of Milwaukee Health Department. So I am reaching out to people who have tested positive for COVID, learning about their contacts, checking in on their symptoms, and informing them about how long they have to stay at home and helping them get the resources they need to go about their life while they're at home. Right now, I'm also applying to medical school. I'm really interested in primary care and potentially in family medicine. So hopefully next year, you'll see me in a little white coat.
That'd be wonderful. And so how do you think your VISTA experience might carry forward into your future work in medicine?
I mean, it was such an eye-opening experience to really work in a clinical setting in a way that I never got in shadowing or even hearing stories about clinical medical care before. I really got to be a part of the clinical team in talking about which medications were available to patients, how we could get those medications, the processes, the procedures. So I really got to work with every member of our clinical staff on that kind of thing. And it showed me how important a good working environment is and how important a physician is, but also a physician can only get you so far, especially in a low resource environment. Our case manager, Alicia, does so much good work for these patients that extends beyond what they do in the doctor's office, but is really critical to their overall well-being.
That's great. And then good luck with the medical school application process. And thanks so much for the work you're doing right now, helping with the follow-up for those testing positive for COVID-19.
Yeah, thank you.
And then congratulations again, Monica. And thank you so much for talking with us today.
Alrighty, thank you for having me.